It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that of course help change people's lives.
They certainly do, and we're going to start off with our first best doctor. It's plastic surgeon Dr. Robert Wilcox.
Well, Mommy Makeover is a term that incorporates recontouring and improving the body, in particular after one or multiple pregnancies.
Over the past 6 years, I've lost a lot of weight and have had a baby and just had a lot of imperfections that I didn't like about myself that made staying healthy difficult.
What a Mommy Makeover incorporates is usually a tummy tuck, which tightens the muscles and the skin and removes the lower abdominal stretch marks. And oftentimes there may be loss of breast tissue from the pregnancy and subsequent nursing, or there may be drooping in addition, in which case breast augmentation or a breast lift or the combination of the two is done in conjunction with the tummy tuck. And then there may be need for liposuction as well in, for instance, the hips or the thighs.
My concern is I'm a working mom, so I knew I couldn't take off several months after each procedure, so that was a big concern of mine. And I'm a respiratory therapist and I work 12-hour shifts on my feet, so I had to be able to be active when I came back to work. That was a big concern of mine. So Dr. Wilcox explained how he would divide up the Mommy Makeover that would best fit my schedule and my lifestyle. He definitely put me at ease over everything that would be done and what to expect after it was done and how it would look.
Looking in the mirror and not liking what you see, how more personal can that be? And now to look in the mirror and say, I not only look good, I look good for my husband. That's a knockout there.
Even going to buy a new pair of shorts or a sleeveless shirt. I used to wouldn't wear short sleeves or a sleeveless shirt, and it's just a freedom that you have to go think something's cute, try it on, and it does look cute. I am very pleased with the outcome and service that I got from Dr. Wilcox, and it is the best outcome that I ever could have thought.
I was in a bad car wreck in 1985. A drunk driver hit me, and I wasn't hospitalized, but it was, I took a pretty good hit to the neck and head. My life had got to a point where I couldn't even walk around the block without being in neck pain. I was having a lot of difficulty at work. I'd been playing water sports, and it got to a point where I just had to give them up because it was just causing too much pain for my neck.
When Monty came to see me, he was complaining of a lot of neck pain, and arm weakness. We looked at his MRIs and x-rays, and what we found was a disc herniation was hitting part of his spinal cord and his nerves, and that was causing the pain shooting down his arm.
We had waited several years for the technology to get better because all the doctors had turned us away, but when we came to Dr. Rimlawi, he explained how technology was real advanced now in the neck surgery area.
Because of new technologies today, we can perform surgeries that are muscle sparing. And that really is huge because traditionally surgeons cut through muscles. And what we realize now when you do that, that really causes a lot of bleeding, which leads to scar tissue, leads to more pain. So we go in between muscles, and there's a muscle going this way and a muscle going in here. And we go in between the muscles and get down to the neck and they were able to shave off bone spurs, take out a disc herniation that's hitting the spinal cord, free up nerves, put in new discs if we have to, and stabilize the neck. And doing that, it makes it much easier on the patient, much quicker recovery, less blood loss, less scar tissue, and it's just not as painful of a surgery at all. And a lot of times patients really experience very little pain.
I'd had surgeries before, so the day of my surgery, it was only supposed to be about an hour and a half long, so I wasn't really nervous, but I was excited to have it over. And so when I woke up, that's the first thing they asked me if I had neck pain, and I had no neck pain. So after 10 years of neck pain, I'm finally able to go back to a normal life because of Dr. Rimlawi.
Is your energy lacking? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or a cup of coffee at fighting fatigue.
I am a referral specialist for 4 doctors, and what I do is I receive referrals from other doctors, and then the doctors, they see the patients, and if they tell me that they need to be referred to have a CT scan or an MRI, then we choose the facility, which I prefer Preferred Imaging, and then I send them an order for them to have either an MRI or CT scan.
Preferred Imaging stands out in customer service excellence. I'm able to get our patients in same day, and the patients are happy. They get in, they get out.
I've heard that patients, when they come to the Preferred Imaging, they feel like they get first-class service and very nice people to work with, and as if they were going into, on an airplane flight, it's first class all the way through.
Because we get the results within 24 hours, we're able to get the patient back right away and the same week, and we can diagnose the patient via the MRI results, and we can therefore know how to treat the patient and go from there.
They're always nice on the phone, they're eager to help, and there's no miscommunication at any point at all. So it helps me when I'm able to call any facility that I can, and then they're there to help, and they're always nice, and it makes it easier for us.
Preferred Imaging has 14 imaging facilities around the Dallas-Fort Worth area, and they do have extended evening hours during the week, and they're also available on Saturday and Sundays. So it accommodates all of our patients' needs. Whether they have to go after work, before work, on the weekends, they really make it easy for the patients. We send over an average of 10 to 15 a day. Our experience with Preferred Imaging it's amazing.
As always, to check out lots of great videos on all of our incredible doctors, head to our website, bestdocsnetwork.com. Now we're going to check in with our next best doctor. She's a minimally invasive bariatric and general surgeon. It's Dr. Preeti Malladi.
Before I met Dr. Malladi, I had gotten up to 447 pounds. Normal things that normal people can do that are in shape, I had a hard time tying my shoes. You think that's no big deal? It was hard for me to tie my shoes. You wouldn't believe this, but I used to be a Marine, and so I was always in shape, thinking everything was in shape, and just over the period of years, man, I lost it. I was an excellent basketball player. It got to the point where I couldn't play basketball no more. I stopped playing softball. All of that ceased. I lost out on just doing things with my kids, and that hurt. I came to a point in my life where I realized, man, I couldn't do this no more. And so it's just a lot of, embarrassment.
Roy is a great patient of mine that came to me after struggling with his weight for years and years. He had developed multiple medical problems, including diabetes, high blood pressure, and sleep apnea. And he actually told me that he had really lost hope in his ability to overcome this problem. And we discussed how bariatric surgery can really help him achieve his goals of weight loss, but also to be able to get rid of these other medical conditions. Well, what's interesting with obesity is that adipose tissue is also a hormonal organ, and it actually can affect other medical conditions and cause people who have predisposition to diabetes to get type 2 diabetes or have other medical issues. The fat actually can infiltrate certain organs and cause problems. And so when you perform weight loss surgery, you can actually not only lose the fat, but you're really affecting these medical conditions at their source. And so this is something I want people to be aware of, that helping resolve your obesity can resolve these other medical conditions.
I wish I had did the surgery years ago. I went from 447 pounds to now, I weighed in last week, I was 316. I went from a size 66 waist to now size 50. I'm no longer on my diabetes medicine, and now I feel rejuvenated again, coming back. It makes a big difference, man. And I just want to encourage anybody that's thinking about it, you need to do it. You need to do it.
Patients often ask me how long they are contagious. Obviously, they don't want to expose other people to what they have. Well, for most diseases like the flu, bad colds, things with fever, you're contagious until the fever is gone for 12 to 24 hours. I usually tell people you can go back to school or be around people without putting them at risk once you haven't had fever the night before. So if you don't have a fever after 6 p.m. at night, then the next day you can be around people. Now, the problem is you're probably contagious before you get the fever with many illnesses, maybe 10 to 12, maybe up to 24 hours. In chickenpox, you may be a couple of days before the chickenpox breaks out or gives you a fever that you're contagious. But for most diseases, it's that 12 to 24-hour routine, so that's when you want to stay away from people. Now, there are other things like hepatitis. Those can be contagious for a long time, a couple of weeks before you even know you have it, and even for months and years afterwards. So ask your doctor about those particular diseases, but on the others, just use that rule of thumb, 12 to 24 hours.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Having a breast augmentation was something that I've wanted to do for a long time, and finally I just had enough courage to pursue it. And my fiance knows Dr. Azouz, so he contacted him and we went and met with him.
Nadia came in with her fiance and she was complaining that her breasts were too small and saggy. So it wasn't just a question of volume. She wasn't looking just to be bigger. She wanted her breasts reshaped. She felt that her nipple areolas were too low, and she basically, for a woman in her mid-30s, she had very saggy breasts and she wanted them larger. She wanted to have this done before she got married, and we were planning a breast augmentation and a breast lift at the same time.
And he said, well, I can take you the following Friday, and I went ahead and scheduled it. So I didn't give myself any time to really think about it or contemplate, second guessing my decision.
There are basically 3 types of implants that we use for breast augmentation today: the saline implant, the silicone gel implant, and the new implant, which is the cohesive gel implant, sometimes called the gummy bear implant. Depending on the patient's desires and needs, the saline implant can work well, the silicone implant can work well, and of course the cohesive gel, the new implant, can work well as well. It's an individual thing depending on the patient, depending on what her anatomy is and what I think would work best for her. And once we've discussed that, the patient and I usually decide what implant would be best for her.
The initial consultation with Dr. Azouz was pretty lengthy. He's very thorough. He takes a long time to make sure that he walks you through each step and process.
The surgery itself is not that long. It's usually around an hour. And then the recovery for the breast augmentation and lift can be 4 to 6 weeks.
The results from the surgery, I went from a 36C to a 36 double D. Thanks to Dr. Azouz, I feel much more confident in myself. He did an excellent job with my breast augmentation, and I would highly recommend him to anybody.
Brushing your teeth can prevent stroke. People suffering from gum disease are twice as likely to have a heart attack or stroke.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
Don't forget, if you'd like to request an appointment from any of our amazing doctors, just visit our website, bestdocsnetwork.com, and click on any of the doctors' profile pages.
Yes, indeed, that is the place to go. And right now, Candace, the place to go is to our next best doctor. It's cosmetic dentist, Dr. Guy Lewis.
I had, the four front teeth were very crooked. 2 were going forward, two were going backward. I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me, so I did some research. I don't know if there's cosmetic dentists up there, I'm sure there are, but I just didn't investigate it, but I did investigate this one and thought, well, this looks like a good as any, and so I did some research, checked into it, and here we are.
Well, Ken had come from Cleveland, Ohio, so he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps on the process because I live so far away. But very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're going to have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, hell, that's funny, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family, my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So, very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, you know, come in and experience it, see for yourself. It really can be very pleasant.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on bestdocsnetwork.com.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength has diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15-20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And you know, I was missing out on a lot. Keeping me up at night or waking me up at night, it would hurt all the way up in my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him and after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I could sleep at night now. I can feel my wife's hair whenever my hands are, you know, run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this, you know, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. You know, I don't know how many things I put off because I couldn't use my hands like I wanted to before. You can actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
For more information on any of their outstanding doctors and watch outstanding videos, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. Right now it's time to head to our next best doctor. It's bariatric surgeon, Dr. Philip Swanson.
Well, Anna was about a little over 200 pounds. She had diabetes and high blood pressure.
I had sleep apnea, and I didn't like the way I looked. And I hated that when I would go to the doctors, they would write down obese. And I didn't think size 18 was obese, but medically, it was considered obese.
We talked about the different kinds of procedures that you can do for weight loss, and she wanted the lowest risk operation that you could possibly do, which is the band. And we spent some time discussing the fact that this is a restriction, and you have to be a very dedicated person in follow-up, that you have to carefully follow your intake, and after the few bites that you eat and then you feel full, that's when you need to stop. We all know that your weight is dependent upon how many calories you take in and how many calories you burn. And so if you can burn more calories, then you can lose weight. If you can take in fewer calories, you'll lose even more weight. And she's done very well with this.
I give myself a goal to reach. Once I reach that, then I try another exercise. So I did Zumba, and that was fun, which I would never do when I was fat. It's been an ongoing journey. It's been a positive one. I've enjoyed it every day because every day I see my scale go down. And it's nice to see those numbers go down. Going down instead of going up. Every year prior to that, my numbers went up.
She's lost down to about 130 pounds. And the benefit of losing that weight is now her diabetes is essentially resolved.
The sleep apnea is gone. I sleep much better at night. Now I'm a size 8, and I'm even more in size 6s. And when I pick them up, I think that is too tiny. And then when I walk by and see myself in the mirror, I have to walk back again and step back. Is that me? I hadn't seen myself skinny. Not since high school. You're hot. I like what I see.
Don't skip breakfast. Fiber in the morning means less hunger late in the afternoon when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than people who just rush out the door.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And, you know, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or you know, redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth looked like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And remember, everyone, and Candace, you may want to jot this down yourself, that is to request an appointment with any of our outstanding doctors, head to the website, bestdocsnetwork.com, and click on the doctor's profile page.
That's right, and if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.